Welcome everyone to our Alcohol and Aging Q&A with Dr. Eric Tam. It's always a special event when we have Dr. Eric here. He is the best doctor in my opinion. I bombard him with my own medical questions. But he's going to be talking to us today about alcohol and how it affects the aging process. He'll be answering a bunch of questions that all of you guys submitted. And just a quick little thing about our Q&As. If you guys want to just mute yourself during the Q&A, you can always pop a question in the chat. If you can also raise your hand on Zoom, and we can call on you and you can ask Dr. Eric a question out loud. But we definitely get to pretty much all the questions in the chat if you have one. And then at the end, we'll let you ask a couple questions before we have to wrap everything up. So without further ado, I will welcome Dr. Eric Tam.
Hey everyone, it's good to see everybody again this early morning. I missed you guys. I think it's been a little bit of time that's passed since I've seen all of you in an event. And I'm really excited about the topic today. I think, first of all, you guys posted such amazing questions. I saw a lot of consistent repeats of questions, which lets me know which ones are of utmost importance, and we'll definitely get to those. And today's kind of meant to be more of a casual event. You know, I don't want you guys to see any of this as medical advice or anything like that. Rather, this is just a forum for us to learn from each other and learn a few things so that we can continue to make good lifestyle choices that will continue to just better our daily lives, okay?
I'm excited. Should we get started with the first one?
Let's jump into it.
Let's do it. Okay, so just starting with the basics. If you're someone who wants to, have a drink and you're not really sure how much you should have, what is the, recommended consumption amount of alcohol?
Yes. Okay. So this is a question that I saw pop up maybe 10 times when we solicited questions from you all. So it's such an important question because it really sets the foundation for everything else that we're going to be discussing today. So I think, we hear a lot in the media and society about moderate alcohol consumption. So the question is, what does that really mean? And what does that really entail? So I think to understand that, we have to first define what is one standard drink, right? So everyone has different preferences and what they like to drink in terms of alcohol. So we have some fans of beer, wine, spritz, malt liquor. So it really depends, right? So a standard drink is different based off of the type of alcohol you're drinking. So for example, for beer, one standard drink in beer is basically 12 fluid ounces or also 355 cc's. Right? If we're talking about wine, it's about 5 fluid ounces. If we're talking about hard liquor, spritz, we're talking about 1.5 ounces. So that kind of at least first, sets the ground rules for what is one standard drink. So then the next question is, well, what is considered moderate drinking? So moderate drinking, first of all, there is a difference between genders, mainly due to the fact that, our bodies process alcohol differently in that way. So for women, it's basically up to one standard drink a day. And for men, it's up to 2 drinks a day. So if you're taking it from like a week standpoint, right? So it's about 7 drinks a week for women and about 14 drinks, for men. But I think it's also important to shed some light as to when we're doing the drinking, right? Because if someone's telling you, I do about, a drink a day and I drink about 7 drinks, then I would say, okay, you're probably doing the right things in terms of moderate drinking. But if someone else is telling me, well, every Saturday I like to get together with my friends and have 7 drinks, then we're in a different category, okay? That's when we start talking about binge drinking. So binge drinking, that's defined as consuming 5 or more drinks on an occasion for men or 4 or more drinks on an occasion for women. So, really binge drinking is quite more common than we really, I think, recognize. So for example, 1 in 6 US adults binge drink, and about 25% of those do it on a weekly basis. So binge drinking is actually quite common, but more so it can be quite dangerous. And so kind of just tailoring it to our patient population, about 14% of people between the ages of 45 to 64 binge drink. and about 5% of people 65 and older binge drink. So not insignificant amounts of individuals. And just to kind of briefly run through some health consequences of binge drinking, we're talking about chronic diseases such as high blood pressure, increased risk of stroke, heart disease, liver disease, and also increased instances of cancer, particularly cancer of the breast amongst females, liver cancer, colon cancer, and so on. And additionally, from a cognitive standpoint, we're seeing effects in memory and learning problems as well too. So I know that's a really long-winded answer, but I wanted to just set the foundation for what is a standard drink, what is considered moderate drinking that's okay, and what is considered binge drinking that's really not okay and can be very harmful to our bodies.
That's super helpful, because when I think about certain occasions, for example, if you're going to go to a long event like a wedding and it's, 6-7 hours, and over the time you have, they serve you a lot of different drinks at something like that. So you don't really realize that maybe at that occasion you do, partake in binge drinking, because you're not, it just happens. There's this cocktail hour, and then there's wine, and this, that's, it's hard at the occasions that we all go to, that the temptation is really there because everybody else is doing it.
Absolutely. So that's why with those special events, those little get-togethers, we really have to be careful in those instances and stay cognizant about how much we're consuming.
For sure. Okay. All right. So then, on the flip side, you're talking about the scary parts of alcohol. We've all heard, a glass of red wine is really good for you. So what are the health benefits of alcohol, if there's any at all?
Yeah. So, I think this is the controversial, spicy topic as of late, because I think so much of the research done in the past, do show some substantiating evidence that there can be improvements in cardiovascular health with moderate alcohol use, which is, what we just went over. However, more recent data is showing that actually may not be true. And the reason being is that these studies are often very hard to accomplish. And there's so many variables in play that it's hard to truly isolate whether or not it's the alcohol that's improving these health outcomes, or it's just the fact that these participants or these members in these studies are at baseline at a more healthier state. So for example, if you think about someone that can afford a nice glass of red wine every night, they're probably coming from a much more well-off background, right? That affords some more healthy foods to consume, maybe a more flexible job that allows them to exercise more, that also contributes to cardiovascular health. So there's a lot of variables there that are hard to control for us, in the medical field to truly say, hey, there are substantiating evidence that there's a good improvement in cardiovascular health and so on and so forth. However, what we do know so far, at least, is that moderate drinking is generally safe, and that's okay to continue. But the flip side of it is, if I don't drink alcohol at baseline, should I start to hope that it can improve my health? And I think the answer to that question is, if you're not drinking normally, there's not really a great reason to start. It's because we don't have good evidence that, in fact, it does make a difference in the long-term cardiovascular health, in the long-term of survivability. But for those that are already drinking and are doing a great job about keeping it in a moderate amount, it's okay to continue. But there is, another different health benefit that I want to briefly talk about, and that's the psychosocial benefits of the consumption of alcohol that I think we as medical providers don't talk about enough, right? We're just purely thinking about, well, what's it doing for my heart? What's it doing for my liver? But the psychosocial benefits, there's some studies that are showing that there may be benefits from that standpoint. Particularly, there's a study that was done in Australia, for women over 70, and they showed that moderate alcohol consumption actually increased the reported quality of life and their overall survival. And they think, when we're getting together or when we're drinking alcohol, we're normally not doing it alone. So as a result, we're out with friends, we're enjoying each other's company, we're enjoying good food. And I think that's where a lot of the secondary effects of psychosocial benefits come into play, which, obviously, as we all know, mental health plays a big role in physical health. So really the big takeaway for the question of what are the health benefits, I think it's still to be determined. But for those that currently drink, I think moderation is safe and feel free to continue to do that. For those that currently do not drink, I wouldn't recommend starting just for the sake of potential health benefits. And then we can run through a little more in detail as we progress in this Q&A as to what it is about alcohol that may have some health benefits.
That's pretty funny. Some people are starting to hear those rumors of those studies and, oh, maybe I don't drink at all, but maybe I should start to help my heart health. So that's good that you cleared that up, because I think that's kind of like an old saying that everyone says, like, oh, a glass of red wine, it's good for your heart. So thank you for that. Okay, so then talking about your weight loss journey, how does alcohol affect that? If you're someone who has a goal to lose weight, or maybe someone who's trying to gain weight, how exactly does alcohol affect weight?
Yeah, so at the end of the day, alcohol certainly has calories, right? And particularly it depends on what we're consuming. But I think from a big picture standpoint, there's been some really good studies actually showing that the frequency and quantity of alcohol consumption had opposite associations with diet quality. So, what that means is the more frequent you drink and the heavier you drink, those individuals tend to actually have worse diets versus those that drink infrequently, moderately, tend to have better diets. So just from that statement alone, we can kind of extrapolate. So if you're someone that tends to be drinking often and a lot, you tend to be eating a less healthy diet. And that, as a result, will manifest in probably negative goals in your weight journey. Okay. So in terms of just weight gain in particular, I think, a lot of folks tend to consume alcohol and in that moment are not realizing what's also added in their alcohol, right? So a lot of mixed drinks, we're sometimes neglecting all the sugar content that's in it and really just focusing on how great it tastes in the moment. And that certainly has negative effects in your weight. But in terms of benefiting your weight journey, there are some studies that have shown that, for people that drink moderately, they tend to actually eat better and actually can benefit from a healthier lifestyle from that standpoint. So the folks I'm thinking of are the people that have the occasional glass of red wine with a really nice home cooked meal for themselves. Those are the circumstances I think can have a benefit in weight and benefit in overall health.
That makes sense, because I think when you're drinking too much, you can crave a lot of things that aren't so great for you.
Yeah, and you kind of give in a little bit in those moments.
Yeah, because the psychosocial benefit, you're feeling looser, and that makes sense. Okay, so then talking about the aging process, is there some sort of relationship between alcohol and aging that you can point out for us?
Absolutely. So, we had one member ask a really interesting question, and they asked, I used to have a couple glasses of wine a night with no issues. Now, after menopause, I get headaches and have trouble sleeping. Why is that? So as we age, our ability to process alcohol is significantly reduced. Okay, so just kind of thinking about, all right, if we're no longer able to tolerate alcohol as much as we could before, and we're less able to process it, then more of the toxins, the metabolites of alcohol that are not good for us, that causes these symptoms of headache, flushing, increased heart rate, would then have longer lasting effects in our bodies when we do consume alcohol. So I think one big part about alcohol and aging is just the ability to process alcohol. That's a big factor that changes with age. And then, one thing to also note is, actually there's a lot of people that develop issues with alcohol as they get older, particularly, even in ages after 70. And a lot of researchers deem that just due to the stresses of aging, whether it is, losing some of your family support or loss of purpose in life or whatever it may be that a lot of our aging folks face, sometimes they may turn to alcohol as a coping mechanism, which is something we as healthcare providers definitely need to keep an eye on and also work on to make sure we're supporting all our patients the best that we can. So I would say those are kind of the big things that I would say about aging and alcohol in particular.
That makes sense. And I remember you were talking a little bit about how the long-term effects of binge drinking can really affect your memory. So is there some sort of correlation between alcohol and dementia or Alzheimer's?
Yeah, so that's such a great question. So really when alcohol is broken down to its first metabolite, it's called acetaldehyde, which is essentially a toxin in our body. And we know from numerous studies that this substance in particular is toxic to the brain tissue. So there's, tons of data out there that shows for folks that have been drinking chronically in amounts that are not moderate and are of relative substantial amounts, there shows to be increased risk of alcohol-related central nervous system disease and particularly dementia in the elderly population. So I think it's important to recognize that really long-term and substantial use of alcohol can be quite dangerous and damaging to just our overall, cognitive health. On the flip side of that, back to this kind of ever elusive question of, well, is moderate drinking good? There are some emerging data that shows moderate intake of alcohol may show some reduced risk of developing Alzheimer's.
That makes sense. We have Karen has her hand up, so why don't we, Karen, do you want to ask your question?
Well, sort of. I just wanted to say, I'm not even sure how to phrase this, but when you just spoke about how I lost my mother at a fairly, like when I was in my 40s, and I started drinking, not alcoholically, and so I drank quite heavily for about 13 years, and then but now I have 21 years of sobriety, so I don't drink. So I was sort of hesitating about coming on this, but I've kind of learned something, and I did have a question, sort of in this sense. How can you tell if your brain was damaged by that drinking alcohol that I did?
Yeah, Karen, well, first of all, I want to just say thank you so much for raising this important question and also just sharing with us such intimate details of your life, because you're definitely not alone in those circumstances. So I really appreciate you for doing that. So the first question is, how can we tell if our brain is damaged? Well, for that period of time in particular, it's hard to know if there's going to be long-term effects down the line. It's usually, later on in life when we start manifesting those symptoms that we can then look back retrospectively and think, was that a factor? But to be absolutely certain that it was the cause of alcohol, it's quite hard to tell in the moment. And then it sounds like the other question I'm hearing from you as well is, in those years that you were consuming more alcohol at a higher level, are there going to be long-term damages? So one thing about the liver, which is the main organ that processes alcohol, it's actually quite resilient. And this is by no means encouraging people to drink more and things like that, but to know that the liver can be forgiving. So if there has been chapters in your life where you're consuming more alcohol for various reasons, know that it's never too late to stop, and that, by stopping or decreasing substantially, your liver will give a chance, to recover and then help your body bounce back as well. Okay. But Karen, in terms of, should you be worried about damages at this point in time? If you're not, experiencing symptoms of cognitive impairment, such as, difficulties with memory and, all the other things like that, I wouldn't worry too much at this point in time. Okay. Does that answer your questions?
Yes. Thank you.
Wonderful.
Thanks, Karen. So now moving to, the different types of liquor. I was telling everyone in the chat, I'm really into this hard kombucha that I don't know if you've seen that in the grocery stores nowadays, but it's kind of they're saying it's like a healthy alcohol, which, you know, at the end of the day, I think they're all the same. But then with that being said, are there any differences in health benefits between the different types of liquor?
That's a wonderful, wonderful question, because we had a ton of questions from our members asking, well, if I'm going to drink, what should I drink? So I think, you know, first and foremost, you know, we have an inflammation track on this as well. So a quick plug to check out our anti-inflammatory track in our Mighty Health app about this. But, you know, oxidative stress, and this is going to sound irrelevant, but I'll connect it in one moment. But oxidative stress is really the cause of a lot of our lifestyle related diseases, such as our cardiovascular health, cancer, diabetes, just to name a few. And so alcoholic beverages contain phytochemicals, particularly phytophenols, that have antioxidant properties. So between liquor, beers, red and white wines, studies have shown that red wines actually have the highest concentration of these antioxidants that we think can help reduce some of the oxidative stress in our bodies that can hopefully impact some of these chronic metabolic diseases. So, you know, based off of the choices between hard liquor, beer, red and white wines, you know, from just that scientific standpoint, I would certainly recommend that red wine has much more health benefits relative to the other types of alcohol.
So I'll have to do some more research on that kombucha, because I think it's a newer one.
That's right. That's right.
Okay, so then, you know, a lot of people might just be drinking, but they don't really understand, you know, when is it going to be too much, or how do I know if I'm consistently binge drinking? So how can you tell if you're consuming too much too consistently and it's negatively affecting your life?
Yeah, and I think I would just like to preface this question of, you know, we all consume alcohol for a variety of reasons. You know, some people really enjoy drinking. You know, some people are just having a difficult time in their lives, and that's something that is able to get them through that period. So, you know, alcohol use disorders is quite prevalent. You know, I see it all the time in the hospital and of patients I take care of. But the most important thing is, you know, making sure that alcohol is not getting to a point where it is negatively impacting our health, negatively impacting our relationships, and that we're consuming it in a safe way. So, you know, there's something called the CAGE questions. It's basically a screening questionnaire that I use in my clinic setting, in the hospital, to just assess, you know, whether or not I should be worried about a particular patient and them consuming too much alcohol. So, you know, it's really a quick survey. It's four main questions. And based off of the answering of that, you can get a pretty good idea if, you know, if there's concerns for excess drinking. So for example, a score of 2 or higher, or basically answering yes for 2 out of 4 of these questions is about 76% specific for excess drinking. So it's a relatively good questionnaire. So I just wanted to briefly go over it with you guys. So you can, you know, even ask some of your family members or your friends that you're concerned about drinking some of these questions to get an idea of, you know, how worried you need to be about them. So the first question is, have you ever felt a need to cut down on your own drinking? You know, so oftentimes people that may have drinking, you know, problems or alcohol use disorder may not feel like they actually need to cut down, right? They may be consuming 7 drinks a day, but that may be a no for them. So the next question is have people annoyed you by criticizing your drinking, right? So what that means is, have people been starting to ask you about your drinking? So then this one is a little more outside of yourself, in that now you're going to start thinking, wait, I don't think I have a drinking problem, but a lot of my friends have been asking me if I've been drinking a lot. So now it kind of checks in, okay, maybe I'm in denial, but actually people have been pretty worried about me. The third question is, have you ever felt guilty about drinking? So I think once we get to a point where we're drinking a lot, we begin to know it, you know, because we know we're drinking for a reason, either to cope or to manage of certain stresses in our life. then we start to feel that self-guilt. Okay. And then the fourth question is when, it's really a check to let us know that the drinking is getting pretty severe. And that question is, have you ever felt like you needed a drink first thing in the morning to steady your nerves or to get rid of a hangover? And what that means, your body is becoming dependent on alcohol, in that once you go longer periods of time without drinking, your body is starting to basically freak out and is yearning for that alcohol. And if that question is a yes, that oftentimes lets me know as a medical provider, the drinking is getting pretty serious. So these are called the CAGE questions, CAGE. It's a very basic questionnaire you can find on, the website. And I think it's just a great tool. It doesn't need to be used by just healthcare providers. If you're just worried about, an auntie or uncle or a friend, sometimes just deploying these questions in a non-biased or non-judgmental manner can help also them reflect about their current alcohol use as well. Okay. And then the second questionnaire that is a little more specific, more for, say, a geriatric population, is the Michigan alcohol screening test. And that's another one as well, but is much longer and comprehensive, that is a little more difficult to use in a more casual setting.
Wow, thank you for providing those questions. I think those are all really good ones, and it's just 4 questions we can ask ourselves or ask a friend or family member, and it doesn't sound judgmental or anything like that. So thank you for sharing those with us.
Absolutely.
So we have a few more questions here. This next one I really related to. I'm sure many of you will. And it's about alcohol and anxiety. I personally have an anxiety disorder, so I, try to not drink very much, because I do notice that, if I drink to the point of not feeling great the next day, that really increases my anxiety symptoms. So I'm not sure if that's similar for our other members, but the person who asked this question, they said, why does drinking alcohol increase my anxiety? Is it because of my pre-existing anxiety disorder?
Yeah, I think that's such a great question. Thinking about alcohol and just baseline mental health, sometimes alcohol can definitely be an exacerbating factor. And the question why it does that, it really just goes back to how alcohol changes our brain chemistry. So in particular, it impacts a lot of the neurotransmitters in our brain, particularly dopamine stimulation, that we know in folks with anxiety disorders tend to have increased dopamine already. So to further stimulate that can be an exacerbating factor. Alcohol also affects our serotonin levels, which is a huge controller of mood. And then, the other neurotransmitters includes our GABA neurons, which are the neurons in charge of kind of shutting our brains down a little bit. So that's kind of why we have the sedating effects of alcohol. And that's why a lot of people know that alcohol is a depressant. And that's because of its effect on our GABA neurons. So just kind of, as you can imagine, its impact in moods, its impact in excitement, its impact in sedation, kind of all of that trigger of change can certainly affect a brain chemistry that is anxious at baseline. And as a result, for those folks that, are feeling negative effects of alcohol, that's a great reason to avoid it. That's our body letting us know, hey, this is not treating us any better and is not really offering me any benefit. Maybe it's not, worth it to consume.
That makes sense. Thank you so much for breaking that down. I'm always really interested with how certain things affect the brain. So that was a great little education.
Absolutely.
Okay. So are there, for someone who is kind of craving alcohol but wants to stay away from it, are there any sort of over-the-counter products that you can take to get rid of that craving?
Yeah. So, for people that have been drinking alcohol for a long time and they're working to get rid of it in their lives, there's so many great oral medications out there. They're not normally over the counter. They're normally prescribed, but they're very common and are very safe. And just to kind of walk things back a little bit, we talked about these GABA neurons. So for someone that drinks all the time or, drinks heavily, our brain chemistry changes and adapts to that. So for example, when we drink, we kind of shut down our brains a little bit. So then when we're not drinking, without that kind of suppression, our brains are kind of freaking out, right? And that excitability is always there. And that now we're kind of looking for something that can suppress it back and rebalance ourselves. So that's where the cravings come in. It's like a natural built-in, brain craving in some ways due to its changed chemistry from long-term alcohol use. So then these medications that oftentimes doctors prescribe acts on that pathway. It basically provides, a little bit of GABA, to our brains to basically help rebalance us. So these medications can be, naltrexone, for example, which is a pill you take once a day and can increase the dose to address cravings that are really safe. Or there's medications like gabapentin, that can also do that as well. But there's becoming more and more great studies out there showing that there's good medications that can address the craving to ultimately help you with quitting alcohol if that's a goal and if drinking has been an issue for you.
I didn't know that even existed, so that's great to know. Okay, so we're moving into our last prepared question. So if you've got any questions you want to ask Dr. Tam, you can start to pop them in the chat or, get ready to come off mute. But so how do we know if alcohol is beginning to affect our health? This is kind of similar to what Karen was saying, but kind of this is more live and in the moment. Like, how do you know if you should maybe start to curb your drinking?
Yeah, so, one of the things we notice first with folks that are consuming alcohol at a heavier amount for longer periods of time is just the changes in our body fat composition, our cholesterol levels. So really high uses of alcohol basically dysregulates the triglycerides in our body, the cholesterol in our body. So oftentimes you'll hear the term fatty liver disease. So what happens from a primary care standpoint is, so for example, say you come to my office and you're saying, hey, Dr. Tam, lately I've just been drinking a lot more. I've just been experiencing a lot of stress in my life. Can we check if, there are issues with my body and am I suffering any negative effects from all the drinking? And if I'm concerned, things I would do is I would first start with a liver panel, which is basically a blood test, just checking the function of your liver. So based off of some of those values, that can then lead me to want to take an ultrasound of your liver to then assess if there's development of these fatty deposits, if it's changing, shape in that way. So those are kind of the two major tests that I would deploy in my clinic setting to first know if it's affecting your health from a physical and a organ standpoint. But in terms of just overall symptoms that you may feel, one of the common ones that we see is gastritis. So just a lot of stomach pains, acid reflux type pain, very common in folks that have heavier alcohol use. It's basically, alcohol is almost like a toxin to your stomach lining, causing a lot of inflammation that can cause a lot of stomach pains. But really the most feared complication of alcohol use is liver cirrhosis. And what that means is basically you're drinking, alcohol for such a long period of time that your liver is no longer able to actually function normally. So our liver normally is nice and floppy, very pliable, but as it becomes fibrotic or as you start experiencing liver cirrhosis, it becomes very stiff. It shrinks in size, starts forming nodules. And when that happens, we start to see a lot of scary subsequent diseases that come with it. So, people tend to turn very yellow in skin, start to have jaundice. And that's because the liver is no longer able to process some of the byproducts. And then that ends up reflecting in the color of our skin. Some people start experiencing a lot of fluid overload because, the liver is unable to produce albumin, which is a crucial protein in keeping the fluid inside your blood vessels, and instead starts leaking out into your stomach, your legs. So oftentimes people with cirrhosis, you see with, huge bellies with a lot of fluid filled in there. We see people with just bleeding from the standpoint of worsening gastritis, developing tears in their esophagus or their stomach. So the consequences of long-term alcohol use can be very scary. But I think, not to scare anyone here, it's just important to recognize the long-term sequelae of alcohol use in a non-safe way. But in terms of just checking in with your doctor, I've been moderately drinking. Is there anything I need to be worried about? Generally, no. And then if we really wanted to, we can just do a quick lab draw to check out your liver function. And usually if you're drinking at a moderate amount, as we, discussed earlier in this talk, I wouldn't worry. Yeah.
Thank you, Dr. Tam. Does anyone have some questions you want to pop off mute and ask Dr. Tam while we have a few more minutes?
Don't hesitate, everyone. I hope I haven't bored you with all this scientific details. I'm hoping that it was, as digestible as possible and helpful to you all. So don't hesitate with any other questions you have.
Oh, it looks like Michael has his. Oh, he was clapping for you. Oh, thank you, Michael.
Thank you, Michael.
That was supposed to be applause. Yeah.
Yeah, that's great.
That was very good. Wasn't boring at all. Very interesting questions. You hear a lot about, like you were saying, Amelia, about you hear about drinks and you hear about, I guess I had questions that I didn't realize I had, and you answered them before I even asked them. So there you go.
All right. That means I'm doing an okay job.
Yeah.
Thank you for that, Michael.
I love that. Jim was clapping for you too. So
Thank you.
Nice.
All right. We have Darlene. Any genetic factors and tendency to drink too much alcohol? And then we have Kelly after. If someone has gastritis and really cuts back on drinking, will the stomach heal on its own? So Darlene, certainly there's a genetic factor in alcohol use disorder, particularly. We still haven't figured out what's the specific gene that causes it and things like that. But, you see a lot of family history in folks that have alcohol use disorder. And it's also one of those things where it's psychosocial, right? Like, if you've seen, your parent growing up as, a heavy drinker, subsequently in your own life, sometimes in stressful moments, you may turn to that as well. I had a lot of patients, young alcoholics that started drinking when they're 13, 14 years old. They tell me, well, like, hey, Dr. Tam, like, this is all I've known. Like, this is what we do in our culture, like we just drink. My dad used to be a drinker. And so I just thought it was normal. I didn't know it was negatively impacting my body in this way. So it's unfortunate, because a lot of these things we don't realize actually wasn't in our control. And when we do decide to get in control of it, sometimes some serious damage can be done. So a lot of the education, aspect is so important, right? Educating parents that drink on the heavier side, on the more frequent side, to let their children know, like, hey, this doesn't have to be, your lifestyle or whatever it may be. And to Kelly, if someone has gastritis and really cuts back on drinking, will the stomach heal on its own? Absolutely, Kelly. So our stomachs are also very resilient. And as you can imagine, if you take away the insult to injury, the body has time to heal itself. So certainly, Kelly, the stomach can heal. All right, what other questions we have?
I have time for one more, so don't be shy. Oh, Kelly gave you a thumbs up. Thanks, Kelly.
Thank you all.
Okay, well, if we don't have any more questions, I feel like this was really, comprehensive and people learned a ton. I know I learned a lot. So thank you so much, Dr. Tam. We really, really appreciate you taking the time to educate us.
Oh, it's my absolute pleasure. And really my biggest takeaway for you all today is, reflect deeply on how you eat and how you drink. Are you someone that occasionally enjoys a glass of wine or beer with a meal? Or are you someone that finds your diet and quality of food suffers when you drink? And so depending on which person you are, try to work on correcting that or keep on doing, the right things. So I think that's what I will leave you all with today. And, we're here to support you all. I hope to continue to do these sessions to just make it a casual conversation. This is an absolute pleasure for me to come and just have a chat with you all. And I'm glad that you guys found it all helpful.
Thank you, everyone. Have a good rest of your day.